Good afternoon, dear students. Proceed further. Now we will discuss our seventh chapter, that is physiology and sports. Under this, we have to cover some topics, that is gender differences in physical and physiological parameters, physiological factor determining the components of physical fitness, effect of exercise on cardiovascular system, effect of exercise on respiratory system, effect of exercise on muscular system, and physiological changes due to aging. So these are the points under which I will cover first topic, that is gender differences in physical and physiological parameters. Sports physiology is the study. First you must have know about the physiology, sports physiology, that I have already discussed with you, that the physiology means the internal systems, and now I will give you the brief introduction. Sports physiology is the study of the long and short term effect of training and body conditions of athletes. Indeed, it is the study of how exercise or sports activities alert the function and structure of our body. As a matter of fact, when we take part in games and sports or do physical exercises, certain physiological changes such as aerobic capacity, muscle composition, size in muscles, intensity of the nerve impulse, lactic acid tolerance, muscular strength, stroke volume, heart rate, blood pressure, etc. take place. These physiological changes are witnessed both in young population and in the aged people also. So first we have to discuss about the gender differences in physical and physiological parameters. Both men and women have different physical and physiological structures. Physical and physiological structures and parameters. However, it does not mean that there is no difference among them on psychologically basis. In fact, the differences between a male and a female on the basis of physical and physiological factors are clearly seen. Physical means anatomical. You can say anatomical means physical parameters, while the differences on psychological basis can be known only through experiments and their behaviors. These differences between girls and boys are not evident up to childhood. They are seen at the beginning of adolescence. At puberty, boys and girls attain sexual maturity, and as a part of growth and development, the body undergoes many changes. Changes in physical features such as height, hair growth, change in voice, muscular body, etc. are evident. Now we will talk about some physical or anatomical differences. First difference is difference in shape and size. There is a lot of difference in the shape and size of the body between a male and a female. These differences are associated with nutritional and other environmental factors. The physique of male is larger than that of female. Means males are more masculine and females are feminine kind of. They are soft and generous, and males are supposed to be strong and muscular body, health and height will be large. So this is the difference in shape and size. You can easily differentiate between men and women, male or female, by the shape and size of the body. Second is vertebra, legs and knees. Now we will discuss about the difference between the vertebra, legs and knees. Through the vertebra in females is usually long, but their upper and lower limbs, means hands and legs, are smaller proportionately, whereas the vertebra, hands and legs of male are longer when compared to females. You can say female are having small vertebra and lower limb like hands and legs in compare to males. Males are having large vertebra and longer hands and legs, or you can say longer lower limb. In females, the greater hip width influences the position and angle of the femurs. Females are having greater hip width. Center of gravity. The average height of female is less and thus they have a low center of gravity. You can see, or you can differentiate the average height of male and female. Males are more longer than female. Males are good height. They have a good length of the body alignment in comparison to females. So the average height of female is less and thus they have a low center of gravity. So because of the less height, because of the short height, we cannot say short height. They are not short in height, but in comparison to male, their height is less. Because of less height, their gravity, the center of gravity is low, whereas the height and therein the center of gravity of males are high. So the center of gravity in females are less because of the less height, and in males are high because of the height. If the height of center of gravity is more, the stability also become less. So if the center of gravity is less, that means you are good in controlling the balance. That means you have good center of gravity. But if your center of gravity is high, that means you have a less stability. Your balance is not good. This implies that the stability of female is more when compared to males. Owing to this fact, females are more successful in gymnastics. That's why females are good in gymnastics, because they are able to control their balance, their stability, because of their height in comparison to male. Now, bones of shoulders. Proportionately, the skeletal width of the shoulder is the same in both male and female. But the larger muscular development in males makes it seem wider. It will seem wider in males because they have a larger muscular development, broad thoracic region, broad shoulders, and that's why they looks like wider. But if you are correlating with the skeletal width, the width of the shoulders in male and female are same. In sports events such as shot put, discus throw, javelin, hammer, hammer throw, etc., the weight of the equipment for female is less in comparison to male. This is the reason, because they have a less muscular development. They have not a larger muscular development. I'm talking about females. Female have not larger muscular development. That's why their shoulder strength, their upper strength is less than males, and they look like also. They seems wider in comparison to female. That's why the weight differences in male and female in throwing events is less in female in comparison to males. Now, pelvis region. Generally, the pelvis region of female is wider than that of male pelvis region. Females are more wider pelvis region in comparison to male. And the next is adiposity. At the time of complete maturity, females have more absolute subcutaneous fat, that means adipose tissue, and their male counterparts than their male counterparts. At the time of maturity, females have more adipose tissue in comparison to males. Generally, females have higher percentage of body fat when compared to men, and they are deposited in the different patterns, with relatively more adipose tissue in the hips and thigh. On the other hand, males carry a greater amount of fat in the upper part of the body and in the abdominal region. So, adiposity, that means adipose tissue in females are more at the time of completing maturity, and those adipose tissue or the higher percentage of body fat in females are in relatively in hips and thigh, more in hips and thigh. And if we are talking about males, the males are greater amount of fat in the upper part of the body or in the abdominal. So their upper part and the abdominal region are having more fat, and in females, thigh and hip region are having more adipose tissue, are having more fat. These are the physical anatomical differences which you can see with your eyes, which you can differentiate with your naked eyes. But because these are visible, these are different in shape and size: vertebra, legs and knees, then center of gravity, then bones of shoulders, then pelvis region, then adiposity, that means percentage of fat. Now we are talking about physiological differences. First is muscular strength. The muscular strength of female is less than the muscular strength of male. In fact, the contraction and extension of muscles in female is less forceful than in male. That means the contraction and extension of muscles in female is less, and it's forceful or more in males because of the muscular strength. Through regular exercise, the muscular strength of an individual can be increased. In female also, but if female or male are doing regular exercises, so there is a difference, then only a difference in strength of the male and female. Then only the male strength is more than the female. Next is blood circulation. There is less amount of blood in females than males. Along this, the size of heart in females is smaller in comparison to their male counterparts. So, in this, we can say because of the smaller heart in female, the amount of blood in female is less in comparison to male, because the males are having large heart size of heart, that's why they have more amount of blood in males. Generally, the rate of heartbeat of female is more in comparison to males. However, this difference exists from the time of birth. This difference is exist, it will remain, it will start at the time of birth. Usually, the heart rate of a female body remains 120 beats at the time of birth, whereas the heart rate of a male baby remains 110 beats at the time of birth. So you can say this difference exists from the time of birth of male and female. Next is respiratory organs. Lungs of female are smaller than that of males. In fact, lungs capacity for a normal healthy female is approximately 10% smaller than a male of similar age and size. You can say if a male or female are of 15 years and a same height, they are having same height and approximately the body size is also the same, even if the lung capacity of female is 10% smaller than the male. So always you can say that the female are having less lung capacity, smaller lungs in comparison to male, even if they are at same age or size, and it is a less in a comparison to 10%, always having a 10% less than male. Female tend to breathe faster than male. Males have more oxygen carrying capacity than female. So it is a physiological fact that the female oxygen capacity is less than males. They have breath faster in comparison to males, and male have more oxygen carrying capacity than females. Next is blood pressure and stroke volume. The systolic and diastolic blood pressure in female are generally about 5 to 10 mmGh lower than male of the same age. The stroke volume of females usually remain 25% lower in comparison to male stroke volume. So you can say that the systolic and diastolic blood pressure of female is generally about 5 to 10 mmgh, and it is lower than the male. Males are having high systolic, males are having balanced or high in comparison to female. It's high, but it's not medically it's not high, because high blood pressure is not good, but in comparison to female, they are having balanced and high systolic and diastolic blood pressure. And in comparison to stroke volume also, female are having 25% lower stroke volume in comparison to male. So this is all about the physiological and physical changes in male and female, or gender differences in physical and physiological parameters. Now I will give you some slideshow that it clearly it will clear the picture whatever I have explained you. So the major physical differences related to appearance in men and women, body structure. First, we will discuss simultaneously. Like first is height. Gain height up to 20 to 22 years, male are taller than females. In comparison to female, female gains height up to 18 to 20 years, and females are shorter than males. Next is weight. Males are heavier. Females are not heavier in comparison to males. Next is shorter trunk, long legs, so the CG is high. In females, shorter limbs, upper body large, so the CG is low. Joints are larger and skeleton is more rigid because of greater bone density. In females, ossification of bones starts earlier. Now in males, broad and strong shoulders. In comparison to male, females are having narrow and weaker in strength. The next point is broad chest and small thorax. Males are having broad chest and small thoracic region. In comparison to males, female have narrow chest and large thoracic region. Smaller abdominal cavity in males. In comparison to male, larger abdominal cavity due to additional reproduction organs. Females are having larger abdominal cavity due to additional reproduction organs, and the males are not having reproduction organs. That's why uterus are in females, not in males. That's why females are having large abdominal cavity and males are having small abdominal cavity. Next is longer upper arm and lower arm. Males are having longer upper arm and lower arms in comparison to females. Next is males are having narrow pelvis region in comparison to females, whereas female are having pelvis region is more open and wide. Next is males carry more fat in the upper area of the body and abdominal region, whereas females are having more fat due to accumulation of adipose tissue at various parts like thigh and hip region. Now we will talk about the physiological differences in male and female. First is cardiovascular system. Size of heart. Large in size, better blood circulation and slow pulse rate. Whereas in females, smaller in size, the size of the heart is small and the faster pulse rate. Next, stroke volume. More in males and less in females. Blood pressure. Systolic and diastolic blood pressure is more in male in comparison to female, and females are having 25% less systolic and diastolic blood pressure in females. Next is more RBC count and hemoglobin, and females are less RBC count and hemoglobin. So this is all about cardiovascular. Now we will talk about the physiological differences in respiratory system. First is tidal volume. Tidal volume is more in males. What is tidal volume? Amount of air inhaled during normal breathing. So it is more in males and it is less in female. If you see the comparison, it doesn't mean the females are not fit, but we will discuss about the difference in male and female. So the tidal volume is less in female in comparison to male. Males are having more tidal volume. Then vital capacity. What is vital capacity? Amount of air one can inhale after forceful exhalation. So it is also more in males in comparison to female. Female are having less vital capacity. Next is residual volume. What is residual volume? Residual volume is the volume of air still remaining in lungs after expiratory reserve volume exhaled. The amount of air is remain in the lungs after the exhalation. This is called residual volume. It is also more in male in comparison to female. Males are having more residual volume in comparison to female. So this is all about the respiratory system physiological differences. Now we will talk about the muscular system. First is muscular differences. Males are having more muscular power due to large muscle structure, and females are having less muscular power due to narrow muscle structure. Next is biological changes. During puberty, biological changes happens like releases of ovum in female and in comparison to male. Now reaction time. Reaction time of males are better in comparison to female. Female are having less reaction time and males are having better reaction time. Next is metabolic differences. BMR better in males approximately 3000 calories, and BMR in female are about 2400 calories. So It is also better in male in comparison to female. So, this is all about the physiological differences in male and female. So, today we have discussed about the gender differences in physical and physiological parameters which differentiate between the male and female. Physical parameters generally you must have seen in your naked eyes. You can easily differentiate the female or male through physical parameters, but physiological parameters are not seen clearly in males and female. It can be measured by physiological ways.